poor emergency medicine services are more disastrous than the disaster itself. Basim Al-Shabani, British Medical Journal.
Welcome back to Inside Iraq. We are discussing the outbreak of cholera in Iraq with three experts, Dr. Zirian Uthman, Dr. Naeem Al-Qasir, and Hisham Hassan. Naeem Al-Qasir, water purification plants in Iraq, most of them are old. Some of them have no maintenance whatsoever. Many of the engineers have fled because of the security. What do you do in such case?
I think, yes, we understand this. And within the United Nations, there is a team who are looking at this between the UNICEF, UNDP, and World Health Organization to assist the government of Iraq with other international partners. However, your message is, what can we tell the people? First, we tell them to boil water, at least for 5 minutes. Second, as His Excellency Dr. Zirian said, many people have wells. We need to teach them how to clean their wells, how to ensure that the chlorination is there, plus inviting the people from the water joint team from the Ministry of Health and Ministry of Environment to do the testing for the water for them. Besides, I have been told that there might be lack of fuel in some of the places in Iraq. Then we are advising that they can plastic bottle, put the water in it, and put it in the sun for a couple of hours, and it will also disinfect the water from the pollutants. On the long-term plan, there are several plans. It might take multi-million dollars, and I know that already, for example, in the north, actions have been taken, and I know also in Misan and Nasiriyah, some water pipes have already been fixed. As His Excellency said, and Dr. Hisham said, we need also to ensure that there is a separation between the sewage pipelines and the water pipelines. Hence, the people can do something, but also the government and international community need to think of the longer-term plans.
Dr. Naeema, yes. You mentioned cleaning the water, purifying the water, perhaps the easy part, Dr. Zirian. How about cleaning some of the ministries that are responsible for the healthcare system? Now it has come about that the Iraqi health minister, the former Iraqi minister who fled the country, Mr. Al-Shammari, has siphoned off millions, if not billions of dollars that was allocated for healthcare system into the militias, and even his deputy has been arrested. To what extent firing corrupt officials in the ministries might go a long way to alleviate the suffering of the Iraqis?
We do need more budget, obviously, to fight cholera, but I'm not sure about the 5 million you mentioned. I don't have any proof on that, but Kurdistan gets its share according to the constitution. We do need enough budget to cover protecting our public against cholera, and our local government has had an open budget to fight this disease, and we have been spending, but we don't have any good networking, we don't have any sanitation or sewage systems, and it takes millions and millions of dollars to build all that in a very short time. For example, Suleimania now needs some urgent big projects. It might cost a few $100 million. We do need the help of the international world. It takes time, yes, but the problem is there now, and we have taken some quick solutions, and it has been working, and the evidence on that is that the disease is on decline.
Hisham Hassan, the Iraqi health system used to be perhaps one of the best in the 70s and the 80s. When the sanctions against Iraq started in 1991, pretty much it dilapidated the entire system until 2003, and with the invasion it would needed only just a little push in order to make it collapse. Is it possible to rebuild a system like that within a very short period of time? Does it need just a national will, or does it need an international effort in order to bring it back into par?
Well, I would say that nothing is impossible at this point. It's true that Iraq is going through a very heavy crisis, but everything is possible. As I said before, this is not an effort to be undertaken by one part only. It should be undertaken, of course, by the government as its main responsibility. But of course, the international community and the international actors, such as international organizations, should also have a role in that. Now, what I can tell you is that a very important factor today in Iraq in the medical system, it's not only the infrastructure, it's not only the lack maybe of equipment in some areas or lack of medical facilities, but it's also the brain drain. That's a very important phenomena that we are witnessing. I would say that according to some statistics, between 70 and 80% of the doctors working, specialists I would say, in Iraq have left, either maybe displaced to another part in the country or just have left their country and their homes. And this is really affecting the health system today in Iraq.
How do you deal with that, Dr. Naima? Without adequate doctors, without adequate specialists, you are left perhaps with just a younger graduate from the medical school to deal with this tremendous problem.
Okay, first of all, cholera is a public health. And I would like to commend, as the World Health Organization, we commend the public health workers, the physicians, the nurses, the medical assistants, who are today, that we are having broadcasting this right now, are doing continuous surveillance system from Nahia to district. I agree with Dr. Hisham that yes, there are brain drains and there are specialists, highly specialized neurosurgeons, cardiac surgeons might have left the country or left the country. At this stage, we need to control public health threats. And we see that there is intensified work. The Ministry of Health is not only Minister of Health and his deputy. The Ministry of Health is a whole, I would say, soldiers, invisible, who are not necessarily always recognized. Cholera outbreak, as His Excellency Dr. Zirian said, can happen in any part of the world. The health is getting the consequences. There are other ministries, concerted action that we need to look at. It's not only the national governments, it's the civil society, the parliament, and we are very happy to see both the parliaments at the central level and the regional level, that is the Iraq and the Kurdistan region, have worked together with the government officials in order to have a say in this control of outbreak. Plus, the UN and international organizations are also key players. I think with everybody's effort, we can contain this cholera, which as His Excellency said, already we are seeing the results.
Yes.
Even though it's contagious, the outbreak has not taken a toll of deaths. And at the same time, we are seeing now a decrease in the numbers in certain areas of Iraq.
Dr. Zirian, my final question to you. As the weather cools, the bacteria responsible for the dehydration for this cholera, it gets a very good environment for transmission. Are we seeing perhaps the beginning of a second phase soon? Well,
the optimal temperature for Vibrio cholera to grow is between 15 and 35 degrees. Temperatures now in Kurdistan is around 25. It's the optimal temperature for cholera to spread, but despite that, with the strict measures we've taken, the disease is decreasing. We are hoping that in November, where temperature drops under 15 degrees centigrade, that the bacteria will not tolerate any longer and will disappear again. I would like to say that again and confirm that cholera is endemic in this country and it will never clear completely. Some foci will remain somewhere in some wheel or somewhere in this part to flare up again whenever there is a chance, and the chances are poor sanitation, poor public education, poor water supply, and the conditions are favorable.
Dr. Zirian Uthman, Dr. Naim Al-Qasir, Hisham Hassan, thank you for being guests on Inside Iraq. To access the show and to send us your comments, please go to aljazeera.net/English. We have reached the end of this show. Join me next week when we take another look inside Iraq. Goodbye.